Winter is here, and so are the illnesses that love to show up with the cold. Today, we're breaking down the most common winter illnesses, what causes them, the symptoms to look out for, and the safest medications you can use to manage each one. Simple, clear, and fast. Let's get into it. First up, the common cold. It's caused by viruses like rhinovirus, and you'll know it by the runny or blocked nose, sore throat, sneezing, and a mild cough. Most colds are mild and resolve on their own, but medications can help you feel better faster. Use paracetamol for fever and pain, or ibuprofen for aches. Antihistamines like cetirizine can reduce a runny nose, and decongestants like pseudoephedrine will unblock your nose. For coughs, use dextromethorphan for a dry cough and guaifenesin for a chesty one. Remember, antibiotics do not work for colds. Next, the flu. It's stronger than a cold, with symptoms that hit suddenly: high fever, body aches, fatigue, and a dry cough. Antivirals like oseltamivir may reduce severity if taken within the first 48 hours. For symptom relief, stick with paracetamol or ibuprofen for fever and pain. The most important thing is to rest and stay hydrated to prevent complications. If symptoms worsen, especially with chest pain or breathlessness, seek medical attention immediately. Cold, dry air can trigger sinus inflammation, causing facial pressure, headaches, and a blocked nose with thick mucus. The best treatment is nasal steroid sprays like fluticasone, which reduce inflammation directly in the sinuses. Decongestants can offer short-term relief, and a simple saline nasal spray is great for moisturizing and clearing mucus. Most sinus infections are viral, so antibiotics are only needed if a bacterial infection is confirmed by your doctor. For those with asthma, cold air is a major trigger. This can lead to wheezing, chest tightness, and coughing. Always keep your short-acting relief inhaler, like salbutamol, with you. For long-term control, inhaled corticosteroids are essential. A simple tip is to wear a scarf over your nose and mouth when outdoors to warm the air before you breathe it in. If breathing becomes difficult, treat it as an emergency. Finally, the winter stomach bug. It's highly contagious and causes vomiting, diarrhea, and stomach cramps. The biggest risk is dehydration, so oral rehydration salts, or ORS, are crucial. Medications like loperamide can manage diarrhea in adults, but the focus should be on fluid replacement. Stick to a plain diet of rice, bread, and bananas until you feel better. See a doctor if you see signs of dehydration, like dizziness or a very dry mouth. To recap, most winter illnesses are viral. Rest, hydration, and the right over-the-counter medications are your best friends. Use antibiotics only when prescribed. Stay warm and stay healthy.